Welcome to Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Dean Kindler, board-certified neurologist, also the head of the Navicent Health Physician Group, and today we're going to talk about returning safely to the hospital for treatment after COVID-19. Dr. Kindler, thanks so much for joining me.
Oh, thank you for having me.
Can you let me know a little bit about how Navicent Health is preparing for patients to come back safely?
Yeah, so at Navicent, we've very focused on safe reentry. And the key part of safe reentry is all the stuff that we've learned going forward as it relates to COVID-19. Most important in that is really making sure that we have people wearing masks. And so we have universal masking. Masking really keeps you safe from me. And so it only works if all of us are wearing our masks. And that's really key as we understand how COVID-19 is transmitted, especially with asymptomatic transmission. And so that is very important. The other thing is the same thing that's important with other infectious diseases, and that is to make sure that we wash our hands and that we keep places clean and that we're cleaning after someone has been in there. So all the stuff that you would expect us to do in normal circumstances, we're doing sort of one level above to make sure that you're safe.
In addition to the two measures that you mentioned around masking and social distancing, can you also let us know a little bit around temperature screening and essential visitation that we have now at the medical center?
Absolutely. So there's no perfect way to know right now who is at risk of transmitting COVID-19. So some of the things that we do, again, is precautionary, like the masking. The other one is to look for people who may not realize that they're developing a fever. And so fever, although it may not be related to COVID-19, a fever tells us that there's something going on in that person that could relate to being infectious, and so that's one important screen. So we take everyone's temperature when they enter into the hospital or any of our ambulatory settings. The second one is really, again, because we know that with COVID-19, one of the risks is asymptomatic, in other words, people who don't know they're sick, having COVID-19 and being able to pass it on, it's really a numbers game. So if we reduce the number of people that we have to check and the number of people that could be passing on COVID-19, we can reduce the overall risk to our patients and to you when you enter into one of our locations. And so that's why the limit to visitation, because as with anything, there's a maximum number of people we can test safely at any one time. And so if we reduce the number of people entering, we can reduce the overall chance that someone who's entering is going to transmit COVID-19.
One of the things consumers often ask us about is how they prepare for elective surgery. Can you let us know a little bit about how we are preparing patients before they get to the hospital?
So a couple things. One is we are testing them pre-procedural to make sure that they don't have COVID-19. Now again, that takes a little bit of time, and so one of the important things is after they've received their testing to make sure that those results are valid, we ask them to isolate themselves until they come into the hospital for obvious reasons, so that they don't get exposed to COVID-19 between when they had the test and when they're having the procedure. And then we're asking them to use the same types of precautions that we would ask anyone to use as they're coming in for the procedure, that they maintain social distancing, that they maintain as they come in, that they wear a mask and the cleaning from that standpoint. But the key thing is that we are testing people to make sure they don't have COVID-19 before any procedure is done.
When a patient is preparing for a procedure or a surgery at medical center and they need to go through COVID testing prior to their procedure, what is a COVID test like?
So the most common test right now is for the antigen. That actually tells us if you have COVID-19. So that's not to be confused with the antibody test that tells us if you in the past may have had COVID-19. And so that's not as valuable to us for procedures as knowing does the person right now have COVID-19. And so that one requires a nasopharyngeal swab, which is a swab that goes in the nose. It's uncomfortable. It has to go to the back part of the nasal pharynx, which is your behind the nose that you see on your face. And it's straight back. And so a lot of times we think that everything goes down, but actually there's a fair amount of space that goes straight back. And so it may seem like it's going in a good distance, and it's a little bit uncomfortable. It doesn't hurt, but it's uncomfortable, and that's very important. So that's the key part that they'll notice is really a swab that's placed in the nose, and that allows us to test for the COVID-19.
Different than the viral testing that you described with the nasal swab, what is COVID antibody testing like for a patient?
So the antibody test, we have to look for antibodies in the blood, and so that's actually like any other blood test that you might have, and so that will be a needle in the vein to draw the blood out, and then that is gone and tested to look to see if the antibodies. So when we're infected with any kind of infection, and we have a system in our body that looks for invaders, if you will, and that's our immune system. And our immune system will remember invaders for a period of time, sometimes for the rest of our life, sometimes for a shorter duration of time. And we'll leave soldiers in place, antibodies, on sentry, looking out for that virus if it comes back or whatever the infection is. And so we right now know that people who have had COVID-19 will mount an antibody response, and that they will have antibodies in their bloodstream. What we don't know is necessarily how many antibodies are effective in preventing a future infection. We don't know how long those antibodies stay around, so there's still stuff that's unknown. And really, it's most of what it can tell us right now is if you had COVID-19 in the past. That to my best understanding right now, we don't know yet if that means that you're immune. So it should not be, so it's very important not to misconstrue that because you have antibodies that now you're safe and you can be exposed to COVID-19 at no risk. We don't know that to be true.
As the head of the Navicent Health Physician Group, can you let us know how the physician group is getting their patients in for their visits using different types of platforms like the telephone or virtual visit platforms?
So great question, and it's been very important during the impact period of COVID-19 for us to maintain contact with our patients. And because although as many of us have heard, and it is true, that just because COVID-19 came didn't mean that every other type of illness suddenly stopped. And so people still have diabetes, people still have heart disease, people still have routine care that they normally would have needed to have treated. Thankfully, we've been able to put in place very rapidly different types of platforms that allow us to interact with our patients without them actually coming to the clinic. And so one is phone calls, and so that's there is a role for some types of checkups to be able to interact with patients over the telephone and be able to understand if they're in danger of needing to be seen, or can we temporize that over the telephone for a period of time. Another great advance has been sort of the more traditional video virtual visit, which allows us to use many different, including an individual's telephone, to be able to interface with have a meeting with their physician and be able to see that physician, and for the physician to be able to, and other provider to be able to see their patient and be able to interact and make some decisions in that regard. And so that has been another opportunity that we've really been able to use. And it turns out that there are many types of visits where either one of those may be sufficient for a period of time. They usually can't completely replace a certain frequency of face-to-face visits, because medicine still is really a hands-on profession where the physical exam is still very important, but it may not be important in every physician-patient interaction or provider-patient interaction.
When a patient is getting ready to come into the office, if they need to come in and see their physician, what are some of the things that Navicent Health Physician Group is doing to keep those patients safe as they return to the office?
Yes, so before any ambulatory visit, before you come to the clinic, our staff will call you and screen you to make sure that you don't have any symptoms or signs that are suspicious that you may have COVID-19 or other illness, and direct you to appropriate care if you do have those symptoms. If that screening is normal, in other words, no red flags that you have infectious illness, then when you come to the clinic, you will see many of the same precautions that we would use if you came to the hospital. So before you come into our offices, we will check your temperature. We'll ask you to wear a mask, and we will ask you to wash your hands after any contact of the surface. We've also greatly reduced the need to be in a waiting room. And so in many cases, one striking, which I think is actually a great thing, is that possibly after this, the concept of a waiting room will be very different. And so sort of coming in and having time to read a magazine, that's really not available to us right now. So you'll see that our waiting rooms are really turning into more greeting rooms, and that you'll see that seating, when available, will be greatly reduced, because hopefully you won't have to spend time there. We are cleaning all of our surfaces, and so after every visit, we're going to do very specific types of cleaning in order to keep the chances of transmitting anything on a surface that you come in contact with is extremely low. And then all of our staff will also be regularly washing their hands, have their temperatures checked before they come to work, and we'll be wearing masks.
Even though COVID-19 has delayed some of the care that patients might have seen over the past few months. How important is it for people to come back for regular screenings, regular checkups, vaccinations?
I think the statements that have been brought up by a number of agencies throughout the country about recommending that we continue routine and normal patient care is fundamentally important. I think it was prudent for a short period of time, starting in February and March, for us to really, until we better understood how we could contain this, to take a very austere approach where we ask people to stay at home and we ask people to only seek us in true emergencies. But all those illnesses that we all have, our normal life, it continues. And so now we need to think of ways of still attending to all the things that ail us besides COVID-19, but also being smart and wise and not ignoring COVID-19, but adapting to COVID-19 and how we give care. So I would encourage all of our patients to make sure that you continue to keep contact with your provider, with your physician or your nurse practitioner or your physician assistant, whomever you get routine care with. Make sure that you keep in contact with that group. And if you are a patient of the Navicent Health Physician Group, please, please, please know that we are thinking about you all the time and your safety. And we are doing everything possible to make sure that you are safe. And we all can work at this together. I think there are some simple things that we can all do together that will greatly reduce the chance of any of us getting ill. And that is for all of us to wear masks when we're closer than 6 feet, or if we're in an environment there is not good air exchange, in a small room or something like that. We know that the majority of COVID-19 is related to airborne, which means something that comes out of our mouth and goes into the air, and droplets, which means relatively large that it can't go too far. So our mask will prevent me from sending that to you. And it's just a common courtesy that we can all do for each other. And then to wash our hands like we've been taught for time immemorial. Wash our hands, wash our hands, wash our hands.
Thank you so much for joining me, Dr. Kindler.
Thank you so much for having me.
And thank you for joining us at Navicent Knows Health. If you'd like to know more about Navicent Health Physician Group or more about COVID-19 resources, please visit us at navicenthealth.org.